This is ABC-7 Xtra.
It is Sunday, October 2nd. Welcome to ABC-7 Extra. Good evening. I'm Stephanie Guadian. So glad to have you with me tonight. Now, the borderland is drawing more options when it comes to higher education programs. For the next half hour, we will take a close look at the new medical school that just opened in Las Cruces, the new dental school set to open in El Paso, and a proposed law school, which would also make its home in El Paso. Experts from each will join us to explain the need for this type of education locally and the long-term payoff in terms of job opportunities, legal access, and health care here in the borderland. We'll also get a glimpse of what students can expect and the high-tech helping to develop a brand new generation of doctors and attorneys. Remember, you can email us your comments and your questions right now to ABC-7 at KVIA.com. You can also reach us by calling 915-496-1771. We want to hear from you tonight, and on Twitter, just remember to use the hashtag ABC7Extra. Texas Tech Health Sciences Center is looking to host its first class of dental students in the fall of 2020. Now, that may be 4 years away, but the path to open the new dental school is already being paved. ABC-7's Stephanie Valle sat down with the president of Texas Tech and shows us what we can expect.
0-6 line.
In the last 35 years, there have only been 3 new public dental schools that have come into being.
And Dr. Richard Lang says this will be the first dental school to open in Texas in almost 50 years. There are only 61 dental schools in all the U.S.
Only about 2 or 2.5% of the dentists who graduate those schools come to West Texas, and less than 1% come to El Paso. So by training individuals here, not only will they meet the needs of the community, but hopefully they'll stay here as well.
Lang hopes 25 to 30% of the graduates open a practice in this underserved area.
We're down by about, 40 to 50% the number of dentists that we need to meet the needs of the community.
And that may happen since El Paso residents will be given enrollment preference.
And if you're from this area and you train here, you're more likely to stay here.
The first dental students will be housed in existing classroom space here at Texas Tech, but eventually university officials tell me they're planning to build a standalone facility in this parking lot on the east side of the campus. Starting with 20 students in 2020, hoping to grow to 80 in the following years. For now, the focus is on the immediate future.
We need to recruit deans, we need to recruit local community dentists to be on faculty, and people from outside. And importantly, we need to develop the curriculum.
An exciting time for dentists and the city. Stephanie Valle, ABC-7.
Stephanie, thank you. And now I'd like to introduce my guests tonight. They are Justin McHorse from the new Burrell College of Osteopathic Medicine in Las Cruces, El Paso dentist Dr. Rick Black, and Steve Fisher, attorney at law. Thank you all for being with us tonight. I want to welcome you to the show. As Stephanie Valle just said, it's really an exciting time for both students and educators. A lot of this is happening simultaneously. Why do you think now? Why is this such a great time for this to happen at the borderland?
Well, I think the vision of the Texas Tech Board of Regents Health Science Center leadership has said what a great match the Health Science Center would have with their medical school, with their new nursing school, with their School of Biomedical Sciences, to have a dental school as well. The future of medicine is collaboration. The future of dental medicine is collaboration. And so it's going to be a great opportunity for these fields of science to get together in one place, especially here in the borderland.
Yeah, it is exciting. When it comes to osteopathic medicine, there is really nothing out there like that, at least here in the borderland. In fact, there's not too many of these schools across the country.
There are currently 34 colleges of osteopathic medicine. And what makes osteopathic medicine different from allopathic medicine is that osteopathic medical students take the same coursework as medical students do, but they also take an additional 300 hours of instruction on osteopathic principles and philosophy. Most of that entails osteopathic manipulative medicine or therapy, which is a hands-on approach to diagnosing and treating symptoms of pain, and it really it really addresses that in a different approach.
And this is a good time for this school, which just opened up recently, because there are a lot of students wanting to go into this type of medicine?
Absolutely. New Mexico and the borderland area has one of the highest needs for healthcare in the nation. And so that, coupled with the number of physicians that are getting close to retiring, makes it a natural fit for the College of Osteopathic Medicine to be here in the southern part of our state.
Okay, so when it comes to a law school, there might be folks out there watching who say, oh, come on now, we've got enough attorneys out there. But you argue there is a need for more attorneys, especially here in the borderland.
El Paso only has one attorney for every 656 people. We were supposed to get a law school in 1967, but politics gave it to Texas Tech. So you have that lapel on there. There really is a need. Of any metropolitan area in Texas, we have the fewest lawyers except for Laredo. And El Paso's going to grow by another 200,000 people by 2022. So it's hard for someone from El Paso to go and pay $35,000 a year tuition and go to Austin or New Mexico. And besides, if you're going to have these new dental schools and medical schools, we need young lawyers to sue these guys, you know?
Well, I can tell you that earlier ABC-7 did talk to some other community members who were also interested in bringing a law school to the borderland. LULAC has launched an effort to gather community support to bring that law school to the borderland. A group went before El Paso County Commissioners. They're also taking the idea to the city, UTEP, and the Bar Association. The group wants the legislature to fund the school based on an early 1990s lawsuit.
Anybody who wants to go to school from El Paso has to go to Baylor, has to go, they have to go to Austin, they have to go to St. Mary's. Nowhere along the border is there a law school. You know, that lawsuit required the state to provide funding along the border because of the systematic discrimination against higher education along the border.
Well, commissioners didn't take action, any official action on that push. They did voice support in general, but some, like County Judge Veronica Escobar, said it's really not as simple as getting a bill through the legislature.
And it's a lofty, worthy, wonderful goal, which I support wholeheartedly. It's important to work with, I think, the business community as well as the actual universities, in addition to working with the delegation.
And local members of the state legislature told ABC-7 it would take new appropriations to get any funding for this effort. I want to turn back to my guests right now. Let's talk about some of the benefits of bringing these schools to the borderland. Obviously, there's going to be job opportunities as well as opportunities for students.
Absolutely. A dental school is going to require professors. It's going to require support staff. It's going to bring new people to town who are going to be able in turn to help support our city services. We're excited. There's going to be a lot of local folks, I think, that'll be involved in the faculty of the school. Right now, 1/3 of the faculty of the medical school is local physicians, and so I have a hard time finding local dentists who are not excited about the school being here. So that economic part of that is very important to realize.
And you touched on, I think, another aspect that is important probably to a lot of people here in the borderland, and that is the opportunity of getting students to stay in the borderland, stay with their families and practice what they've learned.
Sure, a lot of people, they take care of their parents and grandparents. Not my kids, but Yui, at any rate. And sure, and even having other people from other parts of the state come to El Paso and see our place, and even if they go practice somewhere else, it's still going to be an advantage.
So why do you think the borderland has been lacking in this type of educational programs?
Well, I've practiced law and I've served as district attorney all around the state. El Paso just doesn't have the respect and reputation that it needs, so we get left out. We are the biggest city of the top 40 in the whole United States without a law school. And it'd be an advantage to UTEP too. You can't find a good public university unless it's a medical school or a math school that doesn't have a law school with it. UT has one, but if you look at University of California, they have 4 or 5 of them. So it would help UTEP a lot to have a law school and help their prestige and anything that's good for education, you know, I'm for.
Now, the Burrell School, that's actually located on the New Mexico State University campus, but it's not exactly affiliated with the university.
That is correct. It is an independently operated, separately licensed, and freestanding entity that's not a part of NMSU. But its coming together was very unique in that founding Dean George Machascu had this vision of a medical school in the southwestern part of the United States that would improve the healthcare and also diversify the physician workforce. That was a very compelling presentation to Chancellor Gary Carruthers of NMSU, and so it was just a natural amalgamation coming together to be in a unique place that had a high need for healthcare, and really the impact on the economy has been significant. We have 162 medical students attending BCom for the inaugural year. And it is amazing what the impact they're having in Las Cruces and the surrounding area. Many of the apartments are filled. A lot of the eateries are being heavily utilized. And just the impact they're having in the community is tremendous.
Okay.
Stephanie, you mentioned about revenues. This wouldn't raise local taxes. The local politicians are really good at that anyway. But we have the building, the federal building. People could utilize that. It might take something from the legislature and the state bar, but it's not going to be a local tax issue.
But you haven't, this is something that you are passionate about and are fighting for.
Well, you know, I'm sort of, I write columns around the state. I mean, people like Jenna Monteros and Ray Mancera, they're the ones that really have been working on this for years. I don't want to get credit for their hard work.
What about the dental school? How did that come to be?
You know, I think that folks realize that we are very much underserved. We are isolated here, and as the other gentleman said, you know, healthcare along the border is very, very much underserved by the amount of physicians and dentists that we have. So I think it's terrific that certainly the governor supports this. Certainly the border regions of Texas Tech's made a real commitment to this. And of course, such a great thing to thank you so much for the Woody Hunt and Family Foundation for stepping up to the plate and saying, we think this is important, with a very large check. And so every day, you know, I think that we see people who come from other parts of the state who actually come here to work. And what we'd like to have are our own young people who that we think many will stay and bring sort of a cultural competence to treating our own folks here and really providing extra help for what we have, because we definitely are underserved here as far as dentists, and we have a great need, and we have frankly a lot of people who need the care and they want the care, but they don't really have any place to go to get it.
Okay, we're going to take a short break, and when we come back I want to ask you about that Spanish class that some of the folks are going to be taking at the new dental school. You are watching ABC-7 Extra. When we come back, we're going to take you inside the new Burrell School of Osteopathic Medicine and show you the high-tech, how the high-tech students are working with that equipment, high-tech equipment they're working with. I'll get it out. And if you would like to share your comments or you have questions for one of our guests, you can call our comment line. That is 915-496-1771. You can also tweet me at Guadian ABC7. Just remember to use the hashtag ABC7 Extra. You're watching ABC7 Extra, where news comes first.
The day may end, but our work is never done. There's always something out there we can improve.
There's a very severe shortage of all sorts of healthcare providers, and especially physicians here. So that's why we're here.
Dean George Machascu gave us a tour of the college where future osteopaths will soon fill these seats and use this virtual anatomy table.
Each of the bodies is fully touchscreen capable.
These screens are in all of the lecture halls, and students are able to webcast with other hospitals and medical schools from around the world.
And I think we're incredibly fortunate
to have this level of technology here.
There are also exam rooms, a lounge, and laboratories. Students can practice giving stitches and interacting with robotic patients.
I feel really nauseous.
Then there's the heart of the school.
Take a deep breath in and out.
Where students get hands-on experience in osteopathic medicine.
I'm just very excited to be here. And I mean, the faculty's great, the curriculum's going to be awesome, and the location's amazing, so I'm just excited to get in there and start studying.
We're going to graduate 162 new doctors in New Mexico in 2020. That'll be a significant increase over the number that we have now. It's never going to be enough, but it'll help.
And that was ABC-7's Jamie Warren reporting for us. Welcome back to ABC-7 Extra. I would again want to introduce my guests. They are Justin McHorst from the new Burrell College of Osteopathic Medicine in Las Cruces, El Paso dentist Dr. Rick Black, and attorney Steve Fisher. Thank you very much. Now, you talked a little bit about the big donation that was given to help make this dental school a reality. You wanted to talk a little bit about how the Osteopathic College got started?
Yes, BCOM is a privately funded medical school. It is the primary investors are Mr. Dan Burrell and the Burrell family, as well as the Rice Management Company. If it wasn't for them coming together and joining in on this fantastic idea, BCOM would not have happened. So we're very grateful to those people.
And I got to ask you, you've already opened up, the students are in the building. What's the reaction been from the local community, the people who work and live in Las Cruces?
The local community is very excited that they welcome the medical students. Every time they enter into establishments, restaurants, they're very enthusiastic to have the faculty, the students, and everyone there. And in fact, on Saturday, October 15th, from 9:30 a.m. to 11:30 a.m., we're having a community open house. So we welcome folks who are interested in coming to see the new facility to come on by.
And when something like this does open up, it really does have what you might call financial ripple effect. You know, not just job opportunities for people who are going to work at this school, but like you just mentioned, folks who are going out, they're going to restaurants, they're going to shopping malls, they're spending their money.
Yes, yes. And for each new physician that we welcome to our community, they will contribute $1.5 million back to the community when they're practicing in the environment.
Okay, just great addition. I asked you the question, would it take a big donation to make the law school a reality?
It wouldn't take as much money as it would take pleasing the rest of the state. The state bar directors would have to, I was a recent director, would have to vote on it. The American Bar Association, maybe the legislature would need their approval. And even if that failed, the state Supreme Court could allow members to take the bar. I've already talked to Justice Johnson. Justice Johnson married my wife and I, and he said that they would look favorably at something like that, or in his opinion, if we did everything right. It's a long, slow process, and the rest of the state's not sure whether El Paso needs one, but they haven't heard our case yet.
And why are you so sure that we need one?
I know that one lawyer for 656 people isn't going to do it. A lot of people need legal services, and with more lawyers, more competition, maybe the costs will get a little bit lower, so people can afford a lawyer.
Okay. Let's talk a little bit about where we expect these students to come from. You already have your first class. Have they come from all over the country?
All over the country and even out of the country. We have a good number coming from New Mexico, El Paso, southern Arizona, many coming from California, Florida, New York, Texas, and then a few from outside of our country.
We're a few years down the road from the dental school opening up. What's the number that you want to start with?
Well, I think probably the plan is now to start small, probably 20 in the first class. We'll obviously attract people from all over the country, but we want to give our local young people an opportunity to grow up here, go to high school here, go to college here, and possibly go to dental school here. And we think that that's going to be a terrific way to keep more professionals in our community.
I want to give you a chance just to talk a little bit about how important dental health is for folks. There are a lot of people out there who simply don't have their own dentist and who don't take proper health of their proper care of their teeth. Can you talk about just why it's so important and the impact that can have on a person's body if they don't?
Well, what we're finding is that the oral cavity is really a representative of systemic health, and systemic health is manifested in the oral cavity. And so a lot of things that you find wrong with a person's mouth and their teeth are actually being manifested by other disease they may have, especially diabetes, which is very important in this part of the country. So as I said at first, when we talked about the fact that the future of medicine is collaboration, it's really collaboration with our physician friends, nurses, biomedical science students that we'll be working with, so that everybody's on the same page when you really talk about oral health and systemic health.
Okay. And what will your role be in the new dental school?
Well, I'm helping right now. I'm part of the team that's going through the process, that's helping to get the credentialing done, get the proper studies done, begin the planning that is very important, and it is time consuming. It's going to take some time. We hope by the fall of 2020 to have our first class seated, and it will take pretty much all of that time just to get to that point.
Can you tell us some of the powerful friends, if you will, that have already come to your idea or who are supportive, and who else would you like to see or need to have come on board?
I'd like to see UTEP come on board. I've already explained why that would add to the prestige of the university. I was student body president there in '75, and we started a law center. I want to see the best for that. But to also answer the question before, El Paso's demographics, we have a large younger population. So those people would be attracted to going to law and dental. These 28-year-olds, 20-year-olds, 18-year-olds, they're making babies, they're getting in trouble. So we have an extra need for legal services and for lawyers. Even though it only looks like we have 800,000, our population is bigger at that lower end.
Okay. All right, we're going to take another short break. We do ask people to go ahead and give us a call. Remember, you're watching ABC-7 Extra. We want to take more of your comments and your questions on tonight's topic. That number, 915-496-1775. We'll be right back. Tonight, talking about all the higher education programs that are coming to the borderland. The osteopathic school is located in Las Cruces, but you know, when we talk about the borderland, we're talking about El Paso and Las Cruces and a lot of little cities in between. For folks in El Paso, if they were interested in becoming a student there, would they pay the same tuition as people who live in New Mexico?
As a private institution, the tuition is static for all. But we do have the Burrell Expedited Admission Review program, which is designed to encourage applicants from our region to apply directly to BCom without having to go through the clearinghouse application process. So they don't pay an application fee, and if they meet the eligibility requirements, they get an automatic interview.
Okay, and we're kind of wrapping up with the show here, so I'd really like to kind of open it up to you guys to have some closing thoughts.
Well, you know, I've given you plenty of numbers. I can talk for hours on numbers, but you know, it's really about pride and El Paso. Why shouldn't we have the same thing that other cities have? Why shouldn't our children have the same opportunities? Why shouldn't our population have the same access to legal services? I think, you know, it gives El Paso identity to have the same things and the good things that other towns have. And we've been gone too long without it.
So in your opinion, in your mind, why don't we have those things? Why has it been this way?
Politics. El Paso has like 1.5% of the whole state's vote. That's nothing. We're better off part of New Mexico, probably.
Okay. And your idea of a solution to the problem then?
Well, getting this law school, I think I've suggested to them that they offer like New Mexico water law, and we could attract some people there and get some revenue from that.
And
we're proud of the fact that the medical center, the health science center is going to grow. And we're proud of the fact that instead of losing our young people down to San Antonio and Houston and Dallas, that we're going to have an opportunity for them to stay here and take care of their own families and the people that they grew up with.
Because that's been difficult for them to be able to do that. Once they graduate or they decide that that's something that they want to do, they haven't been able to do it here at home.
Well, what we find is that when they get down to those large cities with lots of opportunity, and maybe they find someone there that they want to marry or be with, they tend to stay. And we know by statistics that young people who train in a certain area tend to stay there after they graduate from professional school. So we really feel strongly that that's going to happen with the dental school.
Okay. And again, I just want to remind people of what osteopathic is and what sort of procedures might be different from just a doctor that they're more familiar with.
Sure. Osteopathic medical students they take the same curriculum as medical students do. The main difference is, though, is that they have an additional 300 hours of instruction that focuses on osteopathic principles and practices. A big portion of that is osteopathic manipulative medicine or therapy, which is a hand-on approach to diagnosing and treating pain and other factors to return the body back to its normal function.
Okay, right now people cannot come to the school as patients, but down the line you're thinking, or yeah, what are you thinking of?
Well, down the line there may be new opportunities for engagement at BCom, such as an OMM clinic, but that is still down the road. So we do not have any opportunities as of yet.
Okay, well, I'm sure you will all three keep us posted on your progress. You'll let us know how developments are going to making that law school a reality.
Sure.
Okay, thank you all.
Maybe we get a free checkup from the dentist.
Oh, all right. Well, thank you all very much for joining us tonight. I really appreciate it. Thank you for watching, staying up late. Have a great week ahead. I'm Stephanie Guadian. This has been ABC 7 Extra. Bye-bye.